The next condition is the anemia of the chronic disorders. So remember, it is also known as anemia of inflammation. So it is seen in patient, it is common type of anemia that is seen in various types of chronic systemic diseases. The underlying cause, so this anemia develops as a secondary consequence of the underlying disease rather than direct damage to the bone marrow. Now, what are the common causes that are associated with anemia of chronic uh, disorders? The first could be infections. The chronic infections, like in case of tuberculosis, HIV, chronic inflammatory diseases, well, that could be rheumatoid arthritis, bowel disease, etc. Malignancies like lymphomas, carcinomas, chronic kidney disease, autoimmune disease like SLE. So these are all related, associated with acute chronic disorders. Now, despite the presence of adequate iron stores, there is functional defect deficiency where iron is sequestered in the macrophages that occurs due to the increased activity of iron binding protein like lactoferrin. So there could be presence of cytoferrins like tumor necrosis factor, interferon, beta, interleukin 1 that are released during this chronic inflammatory state. So these inflammators, remember, these would inhibit the erythropoietin, and that would impair the RBC production. So there is, remember, there is a important iron regulatory hormone that increase during inflammation, that is hepcidin. So this hepcidin would inhibit the iron absorption from the intestine and release of iron from the macrophages that would lead to reduced availability of iron for hemoglobin synthesis. Now, chronic diseases, especially the chronic renal diseases, can reduce the lifespan of the circulating RBCs. How? By increasing the destruction. By due to increased destruction, that would reduce their lifespan. Now, what are the laboratory findings that you would see in a acute chronic disorder? First of all, there would be hemoglobin that you can see is mild to moderate anemia. The hemoglobin below 8 that may suggest additional features. On a blood picture, you will see normocytic, normochromic anemia. However, slight microcytosis uh, and hypochromia can be seen. MCHC is slightly low. Reticulocytes, they are low. Apart from that, there would be reduction in erythrocyte lifespan. You would, on the bone marrow examination, you will see the increased iron in macrophages. There would be increased plasma cells in case of chronic infection. The serum iron and total iron binding capacity, they are reduced. Whereas in iron deficiency anemia, you would see the serum iron and total iron binding capacity, they are increased in case of iron deficiency anemia. In the serum ferritin level, it's increased that indicate that adequate iron stores are there, but there is impaired utilization. Apart from that, you will see gamma globulins, haptoglobins, alpha 1 antitrypsin. These all contributes to increase in the ESR. Now, what would be the treatment? We have to treat the underlying cause, that is inflammatory disease, whether it is an inflammatory disease, autoimmune disease, etc. Apart from that, we can use these erythropoiesis stimulating agents. You can give use iron supplements. Oral or intravenous iron supplements may be considered when there is decrease in the iron deficiency. Blood transfusion may be given. Now, conditions like tuberculosis, lung abscess, osteomyelitis, and pyelonephritis, they all can lead to chronic inflammation that can contribute to anemia. Autoimmune disorders like SLE, they can also lead to chronic inflammation. Other causes could be Crohn's disease, scleroderma. So these all can produce chronic inflammation. Kidney dysfunction can lead to decreased production of erythropoietin and result in anemia.